Hi, I'm Dr. Ted Gertel, and I'll be talking about golfer's elbow in this video. I'm an orthopedic surgeon with the Milwaukee Orthopaedic Group Limited, and I'm the medical advisor for the Aurora Sports Medicine Institute. I specialize in sports injuries, and I see a lot of patients in the office with elbow pain due to golf or other sports. Even though we use the term golfer's elbow or tennis elbow, either condition can occur in either sport. And as a matter of fact, I see a lot of people that don't golf and don't play tennis who get either golfer's elbow or tennis elbow. Before I talk about golfer's elbow, I need to review some of the anatomy. In order for the muscles to work, they need to be anchored to bone. And the tendons are the tough, fibrous tissue that attaches muscle to bone. There are bony prominences on both sides of the elbow, and this is where the tendons attach. This is the lateral epicondyle, and this is where the extensor muscles of the forearm attach through the common extensor tendon. On the inner side of the elbow is the medial epicondyle, and this is where the flexor muscles attach through the common flexor tendon. When you flex your wrist, you're contracting the flexor muscles of the forearm, and stress is applied at the medial epicondyle where those tendons attach. If you do this over and over again, repetitively, you can overload or overuse those tendons, and this causes pain at the medial aspect of the elbow, which is right in this area, and this is what we call medial epicondylitis, or golfer's elbow. When you extend your wrist, you're contracting the extensor muscles of the forearm, and you're placing stress at the lateral epicondyle where the tendons attach. If you do this over and over again, you can get a repetitive overuse or overload syndrome, which we call lateral epicondylitis, and that's commonly known as tennis elbow. When I'm examining an elbow, the first thing I do is look for any type of swelling, redness, or bruising. The next thing I would look for is any area of tenderness. If you have tennis elbow or lateral epicondylitis, this is where the pain is located, and this is where it's very tender to the touch. If you have medial epicondylitis, that's on the inner side of the elbow, this is where the pain is located, and this would be very tender to the touch. I also check the range of motion. We want to see how straight and how much bend you can get in the elbow, and I usually will measure that with a goniometer and compare it to the opposite side. Part of the exam also includes testing strength. One of the things I want to look for is how strong the wrist extension is, because with tennis elbow or lateral epicondylitis, oftentimes you can get weakness when you extend the wrist, and when I resist it, the patient may experience pain in that area. Likewise, if we're looking for medial epicondylitis, when we flex the wrist in this direction, that may be weak, or you may have pain when I resist that. A common treatment for elbow tendinitis is use of a forearm strap. It's sometimes called a counterforce brace or a tennis elbow strap, and it's applied to the upper forearm. One pad is placed over the extensor muscles, and the other pad is placed over the flexor muscles, and it's secured with a Velcro strap. This brace applies compression to the muscles, and so it takes some of the stress off where the tendon attaches to the bone, and this can reduce pain at the lateral epicondyle or at the medial epicondyle on the other side of the elbow. Most cases of acute elbow tendinitis can be treated non-surgically, but it's very important that you rest the area to allow it to heal. Application of ice intermittently is very useful, and taking an oral anti-inflammatory medication can be helpful. Sometimes we need to inject a steroid, which is commonly known as a cortisone injection. Using a forearm strap can also be helpful to reduce some of the stress where the tendon attaches to the bone. Physical therapy or occupational therapy is essential to help learn exercises to stretch and strengthen the area to help prevent recurrences. And if you're doing something wrong in terms of your golf swing, your tennis swing, or any other type of activity you're doing, either in sports or in work, then you need to learn how to do those things properly so that you don't keep re-injuring yourself. What if you have chronic or recurrent elbow tendinitis? That is, tendinitis that just won't go away, or it keeps coming back no matter what you try. In that case, you might not have tendinitis. You may have what we call tendinosis, which means that the tendon is not inflamed, it's actually degenerated, and in some cases the tendon is starting to tear. In those cases, we need to consider some special type of treatment. One of those treatments is platelet-rich plasma injection. That's a treatment where we use your own blood, specifically the platelets in your blood, to stimulate healing of the tendon. The other treatment, which has been very successful, is a small surgical procedure to repair the damaged tendon. We have a very high success rate with both of these types of treatments. I know there's a lot of people out there that are experiencing this elbow pain who are ignoring it, or they may have seen a doctor who told them there's nothing you can do about it. But there is a lot you can do about it, and most of the treatments do not involve surgery. So if you're having this pain, instead of living with it, I would welcome you to see me in my office or come to the Aurora Sports Medicine Institute for a free injury evaluation.